Katie Martin in for Alex Dyke here on BBC Radio Solent. In a few minutes' time, we're going to be catching up with a leading orthopaedic surgeon from the south. Did you know that every year 86,000 hips and 90,000 knees are replaced? That's a lot of joints. With recent advances in 3D printing technology, are these new parts better and stronger than ever? We shall be finding out in just a mo. And if you've got a question for my expert guest, for the orthopaedic surgeon joining you in just a mo, by all means get in touch. 0345 30 30 961. Every year, 86,000 hips and 90,000 knees are replaced. I don't believe it. The average age for a hip replacement is 67 years old if you're male, 69 if you're female. So why are these bits wearing out, and what difference can a new part make to your chassis? Consultant orthopaedic surgeon Mr. Michael Moss joins you live on BBC Radio Solent this morning. Welcome.
Thank you.
It's great to be in the presence of such expertise, sir. I'm just hoping that my knee doesn't creak during the course of this interview. So where do you work, Michael? Where might people have come into contact with you in your line of work?
I work in Chichester, in West Sussex. I have an appointment in the National Health Service at St Richard's Hospital in Chichester, and I work privately at the Nuffield Hospital in Chichester as well. I do go to other hospitals locally, but I'm based around there. So
how long have you been replacing hips and knees?
As a consultant surgeon for 20 years, as a trainee 10 years before that, so I must have done my first hip and knee replacement 30 years ago.
Goodness.
Frightening, isn't it?
And how have things changed?
Things have come on a lot in 30 years. Particularly with knees, in terms of the geometry of the joints, the alignment systems that we have to put them in. And I think in the old days, I think knee replacements had a reputation of being a difficult operation, and the outcomes were rather unpredictable. But I think now that the instrumentation is much better, we are more able to accurately hit the right numbers and make sure the joints are reproducible, so that now the chances of a patient having a successful knee replacement are so much higher than they were 30 years ago. Similarly for hip replacements, with alterations in bearings and the way the implant is fixed into the bone, hip replacements have become a much more reproducible operation. And one of my patients, for example, has just won the British National Over 50 Rackets Ball Championships with a hip replacement in. And that's for normal people, not people who have disadvantages.
Yeah, and that's quite a hefty sport to be playing, isn't it? That's a lot of moving from side to side, which is where the hips and the knees are really getting a bit of a bashing.
Exactly. It's a lot of moving, starting, stopping, turning, hitting, all sorts of things where you don't have a chance to think about your joints. But now he's won that, I think his knees are going to start to wear out next, and that'll prove another challenge.
Now, why do people need to have hip replacements and knee replacements? Have they just done too much dancing in their youth? Is that what this is all about, really? A misspent youth?
Too much fun. There is no doubt that people start their activities younger than they used to. For example, we see a lot more very keen sportsmen now than we used to. We see people going on into later and older age, continuing with their sports and not wanting to stop. So in the old days, joint replacement was all about pain relief. But now it's about pain relief and function as well. They want to carry on doing what they've always done, and that is what we're trying to provide for them.
We shall talk more in a few moments' time. I know that Sarah in Waltham Chase and Lynn in Kingsworthy near Winchester both have a question for you.
BBC Radio Solent newsmakers tell their story.
As I walked from one platform to another, there was a bit of a gathering, and I heard someone say, "Oh, it's got one."
Angela Crabtree says she's been left traumatised after seeing the pest control hawk kill a pigeon.
Yeah, it was very unpleasant.
And spark the conversation.
They're used as a deterrent, the pigeons. It's a natural way of doing it.
It must have been quite distressing for Angela.
A pigeon killed outright by a hawk is far better than being left in a trap.
Could you be the next newsmaker on the Julian Clegg Breakfast Show?
I don't want to risk seeing it again.
Weekday mornings on BBC Radio Solent.
Yep, your choice of listening across the south on BBC Radio Solent from 6:30. Steve serves up breakfast in Dorset, 103.8 FM. Julian Clegg on all other frequencies. Back to the present moment in time, 22 minutes past 11, and I am joined by Mr. Michael Moss. He's a consultant orthopaedic surgeon. He's a knees and hips man. Sarah in Waltham Chase has a question. Sarah, it's all yours. Fire away.
Hello. Yeah, my mother has previously had quite a bad infection in a knee joint that was previously replaced. She now needs a new knee and a hip, but it can't obviously be done both at the same time. What is suggested, because we've still got quite a lot of infection going on, and both joints need doing quite desperately. What would you suggest?
When patients come to me with this problem, I explain to them that the most important and pressing problem is to eradicate the infection. Infections are one of the major problems that we face in joint replacement surgery these days, and although we're very good at trying to stop patients getting infections, you will know from all the press and news articles that there's a problem with antibiotic resistance, and that combined with these superbugs that exist makes life very difficult if an artificial implant gets an infection. So the most important thing is to get rid of the infection, and I'm sure your surgeon will have explained that to you, and that's what they will concentrate on first. It can take quite a long time to do that, and once that is clear, once the infection is cleared, they'll need to spend a little while making sure it doesn't come back before they put the new joint in.
Yeah, because at the moment they've decided that the infection can only be kept at bay. They can't manage to completely eradicate it because of it being attached to the actual knee joint, the metal of the knee joint that was previously replaced in there.
Yes, well, the only way to eradicate it is to remove the original knee joint, and if that can't be done for technical reasons or because of the general state of your mother's health, then she will have to live with the infection, and it's a question of controlling it, which is usually done by something called suppression antibiotic treatment.
Oh, Sarah, I'm sorry to hear your mum's having such a hard time. Oh, well, wish her, if not a speedy recovery, hopefully that she's comfortable for as long as can be.
Thank you very much.
All right, thanks very much for your call. Sarah in Waltham Chase. Lynn is in Kingsworthy. Far away, Lynn.
Hello, good morning, Michael.
Good morning.
I sympathise with the other lady, but reassure her I had an infection in my back op, and it got better, so be patient.
Absolutely.
My question is this. I don't know if I'm allowed to use the word for the mattresses that you can buy these days to support hips and knees and things. Very well-known mattress that they used for the astronauts.
Are these memory foam ones?
Memory foam ones,
are,
that's right. I don't want to use the name.
Others are available.
Other ones are available, temper. And so I spent. I had a discectomy in 1986, and I'm 68 years old now. And like you said, I want to keep active. My husband and I have aches and pains, and we thought we'd invest in one of these. Since I've had it, it seems to give me more pain and not less. During the night, I have a lot of pain in my hip, which is giving up a little bit at my age. I've got a poorly right knee. And in the night, I wake up in pain, turn over to relieve the pressure.
Yes.
So I'm not sure that it's supporting me. It seems to be doing the opposite. I'm just asking the question, and your lady said there that it was a good question. Is it a good idea to keep hanging in there with this, or get rid of it and try another mattress altogether? The sleep part of it is important to us, as well as the fact that maybe one day I'll have to have a knee replacement, which I'm very interested in, and I appreciate the programme.
Well, you've spent a lot of money on a very expensive mattress, so the thing to do is not to throw that away first. If you were my patient and came to see me with that problem, what I would do first of all is to have a look at the things that were hurting. So in other words, look at your hip and look at your knee. Now, it may be that you're developing problems with your hip, and that is why you've got pain at night, and it's actually nothing to do with the mattress.
Right.
So it's a question of treating that first, and that doesn't necessarily mean putting a new hip joint in. There can be causes of inflammation around the hip, which sometimes can be exacerbated by mattresses, but other times may just be there regardless of which mattress you choose, and you might just have happened to have got the timing badly wrong and bought your lovely mattress at the time that your hip was about to play up.
Lynn, may I just add one thing as well? I bought one of those pillows that is kind of a flat square of foam, and it's got a little ledge that goes in the crook of your neck. And I used to wake up in the night, like you, with really sore hips until I found something that supported my neck, and I've been okay since.
And I use one of those pillows as well.
Do you? I call it the magic pillow, which sounds like something completely different. So let's move on. Lynn, it's great to hear from you, and I hope things are better soon. You're welcome.
Thank you.
Pleasure.
Lynn in
Bye.
Kingsworthy near Winchester. Michelle is in Bournemouth. They're coming through to you thick and fast today, Michael. Michelle, what's your question?
Mr. Moss, thanks for hearing me. I actually I'm talking about my mother, who's imminently due to have a knee operation. She's had an X-ray and it's bone on bone.
Yes.
And the reason why I'm ringing is because she's gone to a chiropractor about sciatica in her spine. Now, the consultant at Barnet in Hertfordshire has taken her off the waiting list 2 weeks ago, to my amazement, and just given her morphine to control the pain, knowing that her knee needs the operation, the knee replacement. She's administering liquid morphine by the spoonful herself, and she takes a swig of it, and I'm on the phone to her, and she's saying, I'm going to watch the movie, and I said, just put it on 5, Mum, and she just goes off to sleep, and I said, Mum, are you sleeping? And I hear her snoring. Anyway, she thinks she's out of pain, and it's masking the pain, it's not correcting the knee. That's bad for her GP to allow that kind of conduct, isn't it? It's wrong. Or, she could overdose. I don't know anything about morphine, except it's instant if it's under the tongue, and it's liquid form.
Yes. Of course, you must understand it's very difficult for me to comment without being able to see your mother myself. But I would have thought that your GP would have taken reasonable steps to make sure that the dose he was administering was safe and that your mother understood how she should be taking her medication. I suppose that the reason why the doctor is thinking this way is that he wants the sciatica to settle before your mother has her knee replacement, perhaps. It must be very difficult getting going with a brand new knee joint at the same time as you're getting pain coming down the back of your leg from your back.
She hasn't had a knee replacement.
No, you said that she had bone on bone from her knee, and she was taken off the waiting list for her knee replacement a couple of weeks ago.
Yeah.
I presume that must be his thinking.
Let me ask you a quick question at that point, if I may. You said to get moving with a new knee.
Yes.
Am I understanding that to mean that once you've got a new knee, get going straight away, don't sit there letting it seize up?
One of the most important things, and an essential thing in recovery from a knee replacement, is to move the joint. Joints are there to be moved, and after the operation there's a cut in the front of the knee, and of course it hurts to bend the knee. You've had an operation, it's bound to be painful. That's why we have painkillers, and it's very important to take painkillers after operations, because the most fundamental thing is to move the joint after the operation. If you can do that, and you can do that quickly as part of your rehabilitation, then you will make a better recovery. What
would your advice be to Michelle in Bournemouth? Should she go back to the doctor? Should she go with her mum?
I think the best thing to do is for the daughter to go with her mother to see the doctor, so that they understand exactly what the plan is and understand how to take the medication. 4 ears are better than 2, as I always say, and it's better that other family members listen to the doctor so that everyone understands what they're supposed to be doing.
Let's talk more in a few moments' time, if we may, because I know Steve in Bittern wants to ask you a question, and I want to ask you a question about 3D printing. Let's take a look at the weather across the south today. Cloud building up in the east, brighter and warmer in the west. 22 degrees Celsius today, 72 in Fahrenheit. Largely cloudy overnight with outbreaks of rain, although the further north you are, if you're Winchester and north of Winchester, it should stay dry overnight, 13 degrees Celsius. Outbreaks of rain slowly easing tomorrow, that's Friday morning, and bright spells developing on Friday afternoon. Temperatures similar to today, around 22 degrees Celsius. It was looking a bit hairy in Hayling a few moments ago. How's it doing now, Judy?
Well, a lot of traffic moving around the patch, and you're right, we have got some problems, particularly in Hayling. Accident on Haddon Road by the Yew Tree, creating a northbound delay of about 10 minutes or so. It's a bit less southbound. I think quite a lot of people are diverting around Northney to try and avoid the southbound queue. It's difficult to do that northbound. The motorway network through Hampshire and further afield is busy but flowing. If you're heading up towards Guildford, A31, roadworks on the Farnham bypass at the Shepherd and Flock roundabout are creating a northbound delay of about 20 minutes or so between Christchurch and Leamington. Roadworks on the A337 at Highcliffe certainly creating some long queues. It's worst eastbound towards Leamington. Chris heading down from Ferndown to Poole. Ringwood Road warns that southbound through Longham down on the A348's very slow. No Cows Floating Bridge today. The replacement launch is there for foot passengers and cyclists, but it's a long drive through Newport for all other vehicles. More in half an hour.
Thanks, Jude.
Seen a hold up?
Call the BBC Radio Solent travel hotline.
0345 30 40 961.
My guest this morning is Michael. He is a consultant orthopaedic surgeon working here in the South. He specialises in hips and knees. If you've got a question, you can text me, Solent, and your message 81333. You can call 0345 30 30 961. Also coming up between now and 12, we're going to catch up with a former BA pilot who now teaches pilots in Hampshire how to fly, specifically talking about what happens when a plane hits a bird or vice versa. So we'll be talking about bird strikes and how pilots prepare for them. A little bit later on, talking about the prom and whether or not it's a rite of passage or just a right rip-off.
I like a nice cup of tea in the morning for to start the day, you see. And at 11:30, well, my idea of heaven is a nice cup of tea. I like a nice cup of tea with me dinner, and a nice cup of tea with me tea. And when it's getting late, almost anything can wait for a nice cup of tea.
But you're late. I wait around and then I run to the door. I can't take anymore. It's not you. You let me down again. Baby, baby, try to find a little time and I'll make you happy. I'll be home. I'll be beside the phone waiting for but I love you still. I need you. More than anyone, darling. You know that I have from the start. So build me up, buttercup. Don't break my heart. You are my toy, but I could be the boy you adore. If you just let me know. Although you are true, I'm attracted to you all the more. Why do I need you so? Baby, baby, try to find a little time and I'll make you happy. I'll be home, I'll be beside the phone waiting for you. Why do you build me up, buttercup, baby, just to let me down and mess me around, and then worst of all, you never call, baby, when you say you will. But I love you still. I need you. More than anyone, darling. You know that I have from the start. So build me up, buttercup. Don't break my heart. I need you.
The Foundations, Build Me Up Buttercup, just gone 25 to 12. Katie Martin in for Alex on the mid-morning show here on BBC Radio Solent. My guest is consultant orthopaedic surgeon Mr. Michael Moss. He's joining you to talk hips and knees. what difference has technology like 3D printing made to the surgeries you're able to do now?
3D printing is a very interesting thing. We've actually had it for an awful long time. I spend quite a lot of time visiting surgeons in America, and I was over there probably about 15 years ago when someone demonstrated to me a machine that was able to scan a fractured pelvis, an MRI scanner, CT scanner, and then press a button. There's a lot of whirring and clanking, and the following morning a plastic model of this pelvis popped out on the desk. And the great advantage of things like that is that you can use it to visualise how to reconstruct fractures, how to replace joints. You can see where the deficit in the bone is, and it can allow you to plan what you want to do to reconstruct it. We now have 3D images that can pop up from scanners, so we can reconstruct these images and actually rotate them to look at the whole thing from a different angle rather than printing out the plastic model now. So it sounds new, but actually we've had it for quite a long time.
It's absolutely fascinating. Steve is in Bitterne. Hiya, Steve.
Good morning, Katie. Good morning, Mr. Moss.
Good morning.
I had, when I was 12, 13, 14 years old, I had both my patellas removed at Alton. And the Lord Mayor Trelaw Hospital then, but it's left me with chronic pain since then. I'm now obviously in my late 50s. I've had a Fulkerson's arthrostomy and 2 arthrostomies, and unfortunately my knees were quite shot away at the moment. Obviously I've been under the orthopaedic surgeon for years. I suffer chronic pain in my knees, and also I have neuropathic pain, which with the knees. And my consultant, he's tried so many things, and he's now talking about a knee replacement.
Yes.
But he's actually said it probably won't cure the pain. And also, I am allergic to morphine. It causes heart problems. So all I'm on is liquidane patches and paracetamol. And I just wondered if perhaps you could offer. My doctor's kind of, bless him, he's fantastic, but he's put me through the pain clinic. But to no avail, I'm afraid.
No. I think that if you were my patient, I would suggest that you visited the pain clinic as well. So I think it's the right thing to do. Neuropathic pain is very difficult to deal with, but you have an underlying physical problem. What you're talking about is a Fulkerson osteotomy, which is the best way, according to the literature, of treating the problem that you've had, short of putting in a joint replacement. But if you continue to have pain that is generated by the rubbing between the tendon from the front of the knee and the front of your bone, then you may well benefit from a replacement of the knee. You don't have to have the whole knee replaced. You can just have the little bit at the front replaced. It's a so-called partial knee replacement, and in this case it's called a patellofemoral joint replacement. And what that does, it puts a metal plate in between the tendon rubbing and the bone. And actually we have the technology now to reconstruct and install a new patella. There's something called trabecular metal bone, which is porous metal, which allows your cells from your tendon to grow through it, and it becomes part of your knee tendon, just like the patella. And in that way, you can actually reproduce your articulation. A good way of trying to tell whether this is neuropathic pain or whether it's physical pain coming from the joint is just a simple injection of local anaesthetic in the first instance and see what the response to that is.
It's interesting that you should mention just replacing individual parts, because I think it's maybe is there an element of it gets stuck in your mind to think, oh, that's a whole part of me that needs to go for one part of it that's wrong, and the technology that's enabling us to just maybe look at things a little bit alternatively. I know that's what Mo in Southampton has got a question about. Hiya, Mo.
Hi, Katie. How are you?
I'm very well, my love. Fire away.
Hi, Mr. Moss.
Hello.
Just a quick question, actually. I'm actually a sports coach, and through doing sport for many, many years, my left knee is shot.
Yes.
I fractured my kneecap back in September, and they're going to have to do a knee replacement, but he doesn't want to do it because I'm too young.
Yes.
Now, a fellow coach of mine, we were talking on court one day, she actually had cartilage replacement.
Yes.
Do we not do that in this country? Because she had it done in Sweden.
No, we do cartilage replacement in this country. It's an expensive procedure as far as the National Health Service is concerned, but nevertheless, it can be effective in the right circumstances. cartilage replacement in the patellofemoral joint is more difficult than the knee joint itself, but there is new technology now which allows artificial scaffolds to be placed in the knee, and I've done quite a few of these recently, whereby we put in this artificial material, allow your own cells to grow into it, the material then dissolves, and in that way the articular cartilage can be repaired. That technology has only been available for the last 2 or 3 years, but the early results of it are very encouraging indeed.
Yeah, because this lady, she had it done, because you were saying about it, but she had to go to Sweden to get it done. She paid an awful lot of money to have it done. So why do they not offer it in this country instead of having replacement knees all the time?
I think that the short answer to that is relatively few surgeons do this sort of procedure. It is new. It takes time for these things to leak out into the general surgical population, should I say. And there are relatively few of us specialists that take on these things to start off with.
How much are we talking, dosh-wise? I mean, if you want to pay rather than wait, and I would have thought that if you're having a straightforward hip or a straightforward knee, if you were told that you had to wait and you had the money to pay and you thought, I don't want to wait, I'm going to pay, how much are we talking?
As a ballpark figure, and please don't quote me on this, in a private hospital, the price for the average hip replacement is about £10,000, and for a knee replacement about £12,000. That includes absolutely everything.
Right, OK. And is that both knees or per knee?
That would be per joint.
Right.
I'm sure that if you wanted both done, they may negotiate.
How long are you under anaesthetic? How long does the operation take?
Typically, a hip replacement operation takes about 50 minutes to an hour. It depends on the technique that is used. It depends on whether the joint is cemented or uncemented. But that's a ballpark figure. Knee replacements usually take a little bit longer. The operations can be done much, much faster than that, but using the old adage, measure twice and cut once, it's better to be careful and do it properly the first time than rush things and regret it later. Always take time over an operation.
And if you are thinking about having this done and you're concerned about how much time you're going to need to take out of work, as you say, younger people having these kind of operations done now, they might not be in retirement, they might need to go back to work, they might have children to run around after. How long does the recovery take?
The recovery is split into different sections, and it depends, of course, on your return to work as to what sort of job you have, whether you're driving a desk or doing a much more manual job. But on average, as a sweeping generalisation, with a hip replacement, you should be off walking sticks around the house by about 2 to 3 weeks after the operation, so walking independently by then, and a knee replacement probably about a week later than that. That's with a total knee replacement. With a unicompartmental knee replacement or partial knee resurfacing, as it's sometimes called, very often my patients are not walking with sticks by the time they leave hospital. I've had people walking around the South Downs 10 days after these operations, up hills and down hills, and it's remarkable.
Crumbs. And you said earlier on, actually, the best thing to do is get moving in a safe way, but don't sit there and let things get stiff. And can that be said for our original parts as well? Don't sit still and let things get stiff.
I think that's a very important part of maintaining your own healthy joint, is a healthy lifestyle. Joints need to be moved, as I said earlier, and a little bit of gentle exercise is a very good idea to keep your joints healthy. I don't think high-impact sport is necessarily great for joints. So heavy distance running and one thing and another is not so good, but certainly low impact aerobic exercise is very, very good for your joints.
Wonderful. Well, I was at Keep Fit last night, so I shall go now on doctor's orders.
We won't be meeting about that then.
Now, just before you go, if people didn't get a chance to ask their question today, where can they find out a bit more? Is the internet is it a good place to go for medical advice or not a good place to go?
Well, the problem with the internet is that a lot of people have things to say on the internet that
and
are
it's
not
terrifying.
It is terrifying.
You read the symptoms, you think, oh, crumbs, my head's about to fall off.
You have to be careful. I have a website which is called www.michaelmoss.info, and I think that we have a lot of the stuff we've talked about today is on that website, and also it has links to other websites where the information you can get from that is reliable.
Thank you very much for your time.
Not
it's
at all.
Really great to hear from you, and I know that a lot of people will have benefited from hearing what you had to say. So, Michael, thank you.
It's a pleasure.
Mr. Michael Moss is a consultant orthopaedic surgeon joining you on BBC Radio Solent. You can find out more about him online.